it rolls back or it pulls back?
It
Does
will.
that make sense? Like it pulls back into the socket versus the actual eye rolls.
Um,
I think it just rolls.
I think I.
Okay.
My mom's in the car with me as well. She
Okay.
watches Ivy throughout the day when I'm working.
Mhm. Yeah. I notice when I look at her eyes that her third eyelid, so a little pink eyelid down in the corner, and the one is a little more pigmented on the right side, but they're both a little bit elevated. I don't notice them to roll, or to like to roll backwards when I make a gesture towards her face. However, especially on the right side, the eye definitely retracts back into the globe. It pulls backwards,
Okay, yeah.
which that is um, what happens there is, so she does have decreased facial nerve function on the left side of her face. So the facial nerve is the nerve that innervates your muscles of facial expression, basically, and it controls your ability to blink the eye.
Mm-hmm.
So she has weakness of that ability to blink the eye, and her muscles of facial expression. They're not so much droopy on that left side of the face. They're actually a little bit tauter than on the right side of the face, which can happen with chronic facial nerve paralysis, is that those muscles can kind of contract over time. Um, so the other thing that I noticed about her, however, is that she seems like she tilts her head a bit towards the right side. Is that something that you've noticed at home ever? She
Yeah.
tilts her head in association with her difficulty walking?
Yes, that's been since this happened.
Okay. Has it always been to the same side? Does she always tilt her head towards the right, or has she ever tilted her head towards the left?
I think it's usually towards the right, just the one
Okay.
direction.
All right. Perfect. That's what I see today. Now back to her eye kind of rolling back. What happens is that when an animal can't blink their eye normally, because of facial nerve weakness or paralysis, they can develop a reflex where rather than blinking with their normal eyelids, they blink with their third eyelid. And they do that by retracting the globe backwards, basically. So they pull the eye backwards so that that third eyelid can come up and can blink and can move tears over the surface of the cornea, and can protect the cornea that way. So it's kind of, it develops over time. It's kind of a protective mechanism. But she still does have deficits to the left side of the face, saying that her facial nerve is weaker than it is on the right side of the face. The fact that her head is tilted and that she's off balance tells me that there's a different cranial nerve involved here. Cranial nerve 7, or the facial nerve, is the one, again, that does blinking and facial expression. But the head tilt would come from something affecting cranial nerve 8, or the brain stem itself where that information is processed.
Okay.
Now, the thing that's odd about her neurologic exam, that's atypical about her neurologic examination, is that she has cranial nerve 7 deficits on the left side, but her head is tilting in the opposite direction.
Okay.
So normally if you have a cranial nerve 8 deficit right next to your cranial nerve 7 deficit, normally your head is going to tilt in the direction of the problem, and her head tilts in the opposite direction.
Oh.
So it's a little bit atypical, and it makes me worry that it is possible that whatever's causing her clinical signs is happening more at the level where the facial nerve comes into the brain and where the cranial nerve 8 comes into the brain. Because if that part of the brain stem, or the back part of the brain called the cerebellum, is affected, then we can actually see a head tilt in the direction that we don't expect to see it.
Oh, okay.
So that's the part that about her exam just makes me think she's a little atypical. Now, it is possible we can see idiopathic facial nerve paralysis, and we can also see idiopathic vestibular disease, which can cause head tilts, and other vestibular signs. Sometimes we see them even concurrently, where we'll see idiopathic dysfunction of both of those nerves. Again, they usually happen on the same side of the face. It's not to say they couldn't happen opposites, but it gives me a little more reservation to say that that's probably the situation, and it gives me a little more inclination to say maybe we should investigate this further.
Okay.
If we were to investigate her signs further, the test we would want to do would be an MRI of her brain. That would help us look at the inner ears. It would help us look at the nerves themselves. It would help us look at the brain where both of those nerves come in and their information is processed. And based on what we see on MRI, sometimes we pair that imaging with a spinal tap to see if there's abnormalities in the spinal fluid, and overall, if it helps us better determine what's going on. Prior to doing an MRI, there's a few things that I always encourage owners to think about.
Okay.
So the first is that it's going to require general anesthesia.
Okay.
So for her, I know she had blood work and chest x-rays back about 3 or 4 months ago. So I probably recommend that we repeat those tests prior to general anesthesia, just to make sure she's systemically well enough to undergo anesthesia. Make sure she doesn't have signs of metastatic cancer to the chest, stuff like that. If everything checks out well pre-anesthetically, then the other things we think about when we're going to do an MRI is the cost associated with it. We can certainly get you an estimate for that. The third thing we think about is what are we going to do with this information when we get it? You know, this is a diagnostic modality. It's not a treatment intervention. So if we don't find anything, then we say everything looks idiopathic. This is great news. We don't have to intervene any differently. But if we find that there's a structural problem there that's affecting that cranial nerve, that's affecting the brain where that cranial nerve comes in, then ultimately it's going to depend upon what we think that is. Based on her age and her breed, I'll be honest with you, one of the biggest concerns I would have would be the possibility of a brain tumor. If she has that, then based on where it is it a surgical candidate? Is it a candidate for radiation? Is it something that we want to do palliative therapy for, meaning use medications to try to improve quality of life and clinical signs? If we find something else going on, if we find that she has an inner ear infection on the right side, but then she has idiopathic paralysis on the left side, then maybe we treat the inner ear infection, for example.
Okay.
So it's just going to kind of depend what we find, what directions that we may go from there.
Okay.
What questions do you have? I know I've given you a whole lot of information in a very short duration of time.
I know, I'm crying now.
Oh, I'm sorry.
No, it's okay. I don't have any right now, I guess. This just
Okay.
happened so fast with her. It's just crazy.
Well, and you know, the fact that she is improved, and it sounds like right now her quality of life is really good, she may have some residual deficits. You know, we can see animals with vestibular dysfunction that have a residual head tilt. We can see animals with facial nerve paralysis that don't regain the ability to blink and that don't regain normal facial nerve function, and that's normal. But for her, just because the main reason is because her head tilt is in the direction opposite of what I expect it to be, it makes me a little more concerned this could be something going on at the level of the brain, which makes me think we should investigate it further if we're able.
Okay.
But I understand she's your baby girl, and it's scary. All of us that we're talking about is scary. If she... you know, this isn't a decision that you need to make immediately right now. You know, I know we've gone through a lot, and if you need some time to process what we've talked about, talk to your family about what you want to do diagnostically. We do our imaging usually 2 days a week, and so we have drop-off appointments available for those diagnostic tests that we're talking about. We could do diagnostics as early as tomorrow if you talk and you know that you want to do that. But if you need some more time to think about things, we have MRI slots available both Monday and Wednesday of next week as well.
Okay.
How much?
And you said you can get an estimate?
Yes, I can. So for blood work, chest x-rays, her anesthesia, the MRI, and a spinal tap, well, it'll probably put us somewhere between $2,800 and $3,800 for all of it combined. The main range there is dependent upon anesthetic drugs, anesthetic duration, and whether or not we do the spinal tap. We do the spinal tap at the time of anesthesia if we think it would help us, but if we do that, we usually end up towards the higher end of the estimate.
Okay. Alrighty. Yeah.
Okay.
Sounds
Do
good.
you have any other questions for me now, or do you guys want to take some time as a family to go over everything and then call us if you have questions, or to call us to let us know how you want to move forward?
Okay, yeah, that would be helpful if we can process and then just call.
Okay. Okay. Well, why don't you just give us about 10 minutes or so to get some discharge instructions together for you?
Okay.
I'm going to have Chase give you a call to go over them, and then we'll get her back out to you, okay? And we'll wait to hear from you how you decide to move forward, okay?
Okay, thank you.
Okay. All right. No problem. We'll talk to you soon.
All right, bye-bye.
Bye-bye.